Hi, my name is Lacey Leslie, and this is my MN 524 Curriculum Design Assessment Evaluation Part 2 for infection control within a healthcare facility. The purpose of this curriculum design is to teach a multidisciplinary team the understanding and process of infection control within the healthcare setting. The healthcare setting, particularly that I'm talking about in this instance, is a skilled nursing facility. The general population for this facility is geriatrics. The different team members will obtain a basic knowledge of the common infections seen within this setting that have the potential to spread rapidly and can potentially cause harm to the patients. This curriculum is set up to meet the need of the department and the treatment of the infection. The different departments play an active role in the management of such infections. The course will provide understanding in the infection control process in the facility. Course 1 is basic infection control. This will help develop and expound on an individual associate's knowledge on infection and within this healthcare setting. Particularly, Course 2 is teaching them how to protect themselves, how to protect their patients, and what techniques we use within a facility to prevent the spread of infection. Course 3 will talk about and help refresh, expound on the knowledge for influenza and what specifically we do as healthcare associates to prevent and treat that infection. Course 4 will be the same, just on norovirus, how we as a facility learn how to stop that spread, how to teach the patients, and how to treat that disease. Course 5 is a lab that will allow use a simulation to teach. Would be low fidelity type simulation where I will teach staff how to set up isolation rooms, how to tear them down, what we do with that infectious waste in the end and during the process of isolation. Also to the higher part of the fidelity for the simulation would be the actual act of the associate managing hand washing hygiene and gathering the equipment needed to do it correctly and accurately. So part of what I use for evaluation of this teaching process within the healthcare setting is the simulation, the hand washing simulation, as well as the different methodologies for testing. The multiple choice questions for each subject, including department specific questions pertaining to the roles. Examples of questions to ask all departments will include that basic infection control and general knowledge of the precautions. The questions are developed to evaluate the knowledge in a different way. So there's multiple choice, there's true and false, there's listing, numbering, and then the actual demonstration of the hand washing technique at the end. Hand washing being the most realistic, so it would be the higher of the low in the fidelity to teach the importance of these tasks. I thought that the multi-use of multiple choice, true, false, listing and numbering would provide that evaluation needed to see how effective the teaching tools would be. As far as teaching tools within this curriculum for them would be a lot of PowerPoint presentations, visual aids, hands-on instructing, actually seeing what equipment and how to use it, and then the simulation and some role playing when setting up rooms for isolation, tearing them down, and then using the hand washing. Thank you very much.